Welcome and thank you for joining us today as we explore the critical role of social determinants of health and how we can leverage innovation to address systemic inequities. My name is Marcus Resendez. I'm the CEO of 434 Media, an aligned partner to Velocity Texas, and I'm honored to host this event. On behalf of our esteemed partners, Velocity Texas, Methodist Healthcare Ministries, Duke Capital, and the University of Texas Rio Grande Valley, we extend a warm welcome to you all. Whether joining us in person or virtually, your presence here demonstrates a shared commitment to creating a healthier future for our community. Today, we'll explore how to understand the unique needs within our communities, develop and deliver culturally affirming programs that effectively address SDOH, engage community members in the solution-finding process, leverage emerging technologies to drive impactful solutions, and gain valuable insights from our guest speaker today, Shireen Abdullah, founder and CEO of Yumlish, and the Year 1 MHM Accelerator Cohort Champion, as she shares her entrepreneurial journey and the innovative solutions her company is developing to address SDOH. We're broadcasting today from the eBridge Center in Brownsville, which serves as a hub for innovation and collaboration. We are honored to be here today and believe that by working together, we can create a thriving ecosystem of sustainable enterprises that improve health equity for all. You might be asking yourself, what is Velocity Texas? For those who are not aware of Velocity, Velocity is a bioscience research campus located in San Antonio, Texas, on the historic East Side. Velocity was founded on the belief that life-saving innovations can be developed faster when researchers collaborate across disciplines. Very similar to eBridge, Velocity is a hub for innovation and collaboration, bringing together established and emerging innovators in an inclusive mixed-use community where ideas collide to spur medical breakthroughs. Inspired by the power of innovation, proximity, talent attraction, and inclusive economic development, Velocity has embarked on a bold vision to develop an urban innovation district that will position San Antonio as a leader in developing innovative medical breakthroughs and generate economic growth and investment. The Innovation District will be an inclusive community where collaboration, connectivity, and the colliding of ideas spurs innovation in a connected, mixed-use environment. The designated 70-acre area has the potential for development, especially in coordination with the Department of Defense and the local private and public sectors, and will directly connect the East Side to activity in downtown and to revitalize the historic economic center of the city's East Side. Anchored by a 12-acre superhub, this transformational development will serve as a nexus for San Antonio's thriving life science ecosystem, promoting sustainable economic growth for generations to come. Now, why is that important to you? Because it's not just about what Velocity is, it's about what Velocity does. That being connecting, supporting, and funding. But beyond statements, the actions that are being applied are through the programs and opportunities you're here to learn about today. Multi-year, large-scale investments in community innovation through SDOH alignment. Presented in partnership with Methodist Healthcare Ministries of South Texas, the Community Health Accelerator promotes awareness, research, and innovation related to the social determinants of health. In addressing these non-medical factors that impact personal wellness, the first of its kind program seeks to advance health equity in communities across South Texas and beyond. The Community Health Accelerator is tailored to startups that are working to commercialize innovations that address disparities in education and socioeconomic status, among other factors, and will provide a collaborative and nurturing environment to accelerate the development of these technologies. Specifically, what is the accelerator? The Community Health Accelerator is a cohort-based program that provides growing companies the assistance they need to overcome the challenges that frequently cause startup companies to fail. Programming is modeled after gold standards of industry and includes a structured curriculum, mentoring, business education, operational advice, pitch coaching, peer collaboration, and so much more. Cohort companies will participate in a public demo day pitch event at the conclusion of the accelerator and receive the opportunity to run a pilot program of their technology in the Methodist system. As part of the program, MHM and Velocity have developed a seminar series, which is why we're here today, to increase awareness around SDOH and cultivate a deeper understanding of how to translate that knowledge into innovative and sustainable enterprise. These educational sessions provide accessible information on topics such as market analysis, funding opportunities, and regulatory compliance, empowering individuals and organizations to develop impactful solutions that address the critical needs within our communities. Ultimately, these seminars, coupled with the resourcing and the accelerator program, will serve as a catalyst for creating a thriving ecosystem of sustainable businesses. This ecosystem will not only enhance the well-being of the people and places in our service area, but will also play a crucial role in achieving health equity for all. To begin our discussion, I'd like to welcome Linda Uflin, Director of Entrepreneurship, Innovation, and Commercialization at UTRGV. Linda will educate us on what the social determinants of health are and share her valuable insights on why they're important to health outcomes. Welcome, Linda.
Good afternoon, everybody, and welcome. It is a really honor for us to partner with Velocity Texas and the Methodist Healthcare Ministries to bring this series to you here today. I know we have done this for a past year. We had our first year completion at the end of November of last year, but we want to make sure that we continue driving this message that is so important of how to create innovation out of social determinants of health. But I think it's a little bit for our region. It might still be a bit early in understanding what really social determinants of health means. So by definition, it is a non-medical factors that influence health outcomes. They are conditions in which people are born, they grow, they work, they live, they worship, and they age. It's basically when health is impacted in factors aside from access to care. So to truly understand social determinants of health, 20% of cases or factors are related to access to care, but 80% are related to healthcare behaviors. So it can be from anything that has to do with socioeconomic factors, behavioral factors, it can be quality of life factors. So everything that affects your body is sort of related to social determinants of health in a negative way. So what we're looking here today with this series is really to create a spirit of innovation, to create solutions that can deal with a problem that is in our region or beyond in social determinants of health, and for you, the community, to not only work with organizations for work and private industry to create these innovative solutions, to then bring this area that is so needed of innovation, some of that technology-based solutions that can really support the community. Why are we doing this? Because it's important. Because we live in a region that unfortunately has a lot of those factors, behavioral, socioeconomic, transportation, port security, mental health. So it really helps in finding innovative solutions that can then support the rest of the region, the rest of the state, the rest of the country, the rest of the world. Why not? So we invite all of you to continue in this series, to get informed, to learn the practices, to learn from our speakers, to really understand how your innovation can become a real-time solution for social determinants of health factor. Thank you very much for being here today. We will continue to offer this series throughout the year. Please look out for those messages from all of us, from all the partners. It's a really true, again, it's a real pleasure to partner with my friends at Velocity, because they are true friends of ours. And of course, the ministries that can support all this type of work that is so much needed in our world today. Thank you very much. And on behalf of the University of Texas Rio Grande Valley, welcome to eBridge.
Thank you very much, Linda. Truly a beautiful facility. For those who have had the opportunity to be here, I know that you would say the same. And for those who have not yet had a chance to come here, I would invite you, come one, come all. This is a center that has been purpose-built, has certainly welcomed in a lot of the relationships that you have referenced, but still welcoming more, right? As you continue to find the purpose and the way in which these connections are having meaningful outputs to this community. It's not just about San Antonio coming down and saying, hey, here are the things that we're doing in San Antonio. It's about here are the things that San Antonio is doing to connect communities all in throughout South Texas, and the Valley being a very important part of that, and the relationship, Linda, with you and UTRGV being kind of the leaders in bringing this together. So thank you very much for hosting us. Now I'm excited to welcome our guest speaker today. I was joking a little bit earlier. Can we get her on screen with us really quick? I was joking with Shireen a little earlier. The last time that I saw her was at the Demo Day Pitch competition, which is the end of the accelerator program. She was like, I want to walk out to Beyonce. And the energy that she brought to that competition, and certainly, the result of that is she won. I'm not sure if it was because of the walkout song, so I won't take any credit for that, but really, your energy in the room was palpable. Your passion for what it is that you were doing with your brand and with your technology was very inspiring. So I'm very happy that you're able to join us today. Thank you very much for investing your time as we welcome in another cohort to the Year 2 program. As we were talking earlier, is us continuing to try to connect to the folks who are going through the programs to connect, support, and fund is important, not just for the people that we're welcoming into the program, but for the folks who have been through the program. So, Shireen, thank you so much for your time today. There are some statistics that are merchandised on screen right now. I'm not going to go through them, but please take the time to take a look at that. When I say that we have a rock star in our presence today, I'm not speaking in hyperbole, and I really want to make sure that we have plenty of time for any question answer. I've got a couple questions for you to kind of start the conversation, but once we make our way through those questions, please, I invite those who are in the room and those who are joining us virtually to participate. We want to try to make these sessions as interactive as possible. As you'll hear in the questions that I'm asking Shireen, it really does start with the community feedback. You live in your places. We are trying to inspire innovation in those places through, one, just calling awareness to what SDOH is, two, trying to resource that, but then three, really listen. Listen to what it is that the community needs are, and then trying to align those needs to innovative solutions through these programs. So, Shireen, here's the question that we have is, how can culturally affirming and accessible programs like those focusing on diabetes prevention fill existing gaps in the current SDOH landscape? And before you answer that, and I'll repeat it if you need me to, if you could just kind of give a 5-second on what Yumlish is, and then we can progress into that answer, I'd really appreciate that, just to get some context.
Absolutely. Yeah. Excuse me. Happy to do that. And I also appreciate the intro and the Beyonce song the other day. I don't know how much that played into it, but I'm glad we won regardless. So talking a little bit about Yumlish and the work that we do. So at Yumlish, what we do is we provide prevention programs within low-income populations. So it makes sense in just a second. All of this sort of stems from my own health journey and trying to figure out, after receiving a diet-related chronic condition diagnosis. At the time, I was working for a management consulting company, and I didn't come from a health background, so I was really kind of new into this. And when I did, I quickly thought, okay, I've got this diagnosis. There's a problem. There's got to be a solution out there, right? That's the way you operate. And immediately realizing that the only advice my doctor gave me at the time was, oh yeah, just try to eat healthy. And it almost felt like you'd kind of given up. And that really kind of infuriated me and set me on this journey and this pathway through which I wanted to figure out what to do differently in my health. And I started asking all of these questions, especially within the context of the South Asian foods that I grew up on, that I cook to this day. I was really kind of lost. And after going through that journey, I quickly realized that we're all trying to do better for our families, for ourselves, but we just lack that structured support to really be able to carry us through. And with that, Yumlish was born. So what we do today is we provide diabetes prevention programs within these low-income populations to be able to reduce their risk of developing diabetes, right? So that's at the heart of the work that we do. And it's all web and text-based programs that we provide in these communities. a little context on what you do.
Thank you very much. So to tee the question back up now that we have the context was, how can culturally affirming and accessible programs like those focusing on diabetes prevention fill existing gaps in the current SDOH landscape?
I'll break that question down into two parts, Martha. So what you mentioned around one culturally affirming and the other accessible programs. So I'm actually going to try to tackle accessible first before culturally affirming. What does accessibility really, really mean? If you think of any kind of digital health program, what is the first thing that comes to your mind? Where is this program being offered? If it's a digital health program, I'm going to put you on the spot because I see you. It's offered on your phone, right? That's the immediate thing that comes to mind is a digital health program, something got to do with my phone. It's likely going to be an app. Right? That's the type of thing we think about. And that's where we started. We started thinking about what does accessibility really mean? And we white labeled an app for a period of time. We tried to provide it out in the community. Happy to tell you there's a story to go with that as well. But we provided it out in the community, pretty much gave it away. And we had 0 people sign up. Okay. That's, as a founder, that's a beating. You really don't know where to go with that. When you realize that you put so much time and effort into something and just all of 0 people have signed up for this 100% free program. It wasn't like we weren't marketing it enough or anything like that. It's just what we eventually realized is that there was a technology barrier. And the barrier was that in these communities where we worked, they were largely used to using text messaging, maybe Facebook, maybe Instagram, phones to make calls, maybe YouTube to watch videos and, watch things on their phone. But that was the extent within which they were using their devices. And we were asking them to download this brand new app. They didn't know how to download it. They didn't know how to log in. They didn't know how to set up a password and reset their password and do all of that. And the reason why I'm going to this is because when we started thinking about accessibility was where are they already spending their time on their devices and how can we meet them there? And that was the first part of accessibility that we cracked. And today what we do, and the answer to that for us at least became providing everything we do over web and text. So it's very much intentional to go in that direction. So that was the first part. Accessibility meant reaching them through web and text. That was one. And then what culturally affirming meant for us and the work that we do is representation, right? Is being able to provide and talk about inclusive foods. We're cooking different things at home. We're on different diets. We've got different things that we have to even modify our food choices for. So when we took all of those into account, we realized we need to be talking about more inclusive foods because not everyone is eating the same way. And how do we then we sort of bundle this stuff together to provide it in a way that helps reduce somebody's risk of developing diabetes. So for us, it becomes this way to tailor content, tailor our approach in a way that really resonates in this population, in the way we meet them, where they're spending their time.
To build on that, what are some of the strategies and best practices of leading innovators addressing SDOH in this space, particularly in areas like food security and preventative care?
The best way to sort of build and lead in this space is by any innovator will tell you, like the first step is to talk to the communities that you want to be able to work in, right? Whatever your solution is, even within health or even outside of health, I invite you to first take a period of time to really talk to the people whom you want to impact with your innovation, really understand your users, understand your customers, and sometimes both are not the same. Really get in front of them and understand what are your pain points? Why is this a pain point? What would make it better? What would make it worse? These are all sorts of questions. And, there's this ton of questions out there that you can do when you're gathering user input like that. But when you do, and you just simply ask people, you will be surprised that the answers just exist out there. Those answers aren't turned into solutions just yet. And that's the role that you have to play. So what I say is first, talk to your key stakeholders, understand what their appetite is for innovation. Is there a payment model that exists? We all want solutions for something or another, but who's willing to actually pay for it? Is it your user? Is it, is it a separate customer that you have to go out there and find? So I would say first go out, do that research, really align with this problem that you want to solve, how you want to solve it, and then align that with a business model that you think is going to work. and then start working on it. And don't always think about that you think you have the right answer. I know I thought I did, and I was very naive at the time, and I was humbled by this experience. But be willing to iterate, be willing to take a chance, say, okay, this is just version 1. That's fine. Version 2 and version 10 is never going to look like version 1 again, and that's okay. Don't fall in love with the solution. Fall in love with solving the problem.
You touch on something that I had mentioned earlier in the session, in engaging with the community to create somewhat of a feedback loop and really get the ideas, if you will, from the folks who are living in their communities. How do you feel that we can involve the community members in the co-creation of these solutions to ensure their relevance and buy-in?
I'll maybe answer this question with part of our experiences, Marcus. So when I mentioned earlier, we white labeled an app for a period of time to be able to see if it could work in this population we were addressing. At the time, we went out to this clinic, right? And we, at the time, also thought this clinic would either be a partner or a customer first. We're still trying to figure out our business model at the time. But we talked to this customer, and this was a nurse practitioner at a local clinic. As we started talking to this nurse, and this is not different from any nurse who works at a clinic. She was very adamant about well, I want to do something about diabetes. Diabetes is rampant. It's rampant in our patients. The numbers keep going up, and A1Cs are out of control. And she was giving us all of these problems. We're like, great, okay, something needs to be done here, because here's this person who's struggling to solve this problem for her patients, very, very passionate about solving it. She doesn't have the bandwidth. She doesn't have even the funds to be able to do something about it. And we started there. And I remember in my conversation with her, this is a little bit of a funny tangent for a quick second here, but I remember even talking to her at that time, and the way I pitched to her was like, oh yeah, we have a program. It would be great. Your patients are going to love it. And I'm going to just offer it for free because we want to do this pilot. We just want to see even if, folks like this program. And I remember the time she was really excited, right? Because immediately I was solving a problem for her, which was like, listen, I don't have the money, but I do have all these patients who have diabetes and I want to provide something for them. So she said, don't worry about the cost. We'll provide this program, but just give me as much feedback during the program. And I remember the time, by the way, for context as well, you should know, we did not have a program set up at that time. I was literally putting it together in my meeting, before my meeting for her, in this PowerPoint presentation. That's just a hustle of an entrepreneur. But I remember putting this thing together, and she's like, oh yeah, tell me more about this program. How long is this program? And in my mind, again, note, I have 0 programs. I also come from a non-health background. And so I had done some research, of course, before we're going to go talk to her. And I was like, well, our program is about 12 weeks. And I just blurted that out. It's like, oh yeah, our program is 12 weeks. She's like, oh, 12 weeks. 12 weeks is going to be too long of a commitment for our patients. And I was like, oh, don't worry about it. We also have an 8-week program. Now, you should know about that is that I do not have a 12-week program. I definitely do not even have an 8-week program. I did not have a program to begin with. What I did have is the hustle of a founder to say, it is through this line of questioning that I can build something and understand our needs and what her patients want. Anyway, so went through that journey, and immediately started realizing, and coming back to your question, Mark, is it's a lot of understanding what the other person wants, trying to figure out how can you best address their needs in the way that helps them solve a problem. And if you can solve their problem, you ultimately start solving your own problem in the way you want to be able to innovate in these communities as well.
There's something that you mentioned that I think is very important to highlight, is the fact that you come from a non-health background, and you've mentioned that, but the reality is that you were the year 1 cohort winner. And this is really the spirit of the program, is engaging in these kinds of conversations to try to connect skill sets and resources and things that are going to help us innovate, sure, but then produce great outcomes. And that starting with conversations, because although you don't come from a health background, all of us as human beings deal with health and the social determinants of health and health outcomes. So again, I wanted to make sure that we highlighted that for folks who are just beginning to get familiar with what the program is intended to do, is not try to source people who are in a hospital environment, but really try to source folks who are living in their communities, who are experiencing these kinds of issues, and trying to connect to people like yourself who have a founder's hustle and being able to spin up innovative work. So, thank you very much for mentioning that. To build on that, though, is as programs come and programs go, as we've gotten more engaged in this space, certainly it's been an intensive period of education. And what we've learned is that there's a lot of programming out there. And just as much as it's well intended, I think that there's also a barrier of trust, and trust needing to be built in the community, that there's staying power in these programs. So what are the strategies that you think can build trust and long-term relationships within the communities that we're serving?
I think a couple of things to that. And one is just coming from a place of vulnerability, for me at least. It was saying, I don't have all the answers, but I'm willing to try my best, and I'm willing to hustle hard to make that happen. And that's like a place of vulnerability that you can come from, is like when you walk in a room and you pretend to know everything, well, there's not much the room can do to help you, right? Because you give the impression that you know everything. But if you walk into a room and you're a sponge and you're willing to talk to people and understand their perspectives and their viewpoint, for me, it is all about understanding that. I'm a sponge in any room. I hate being the speaker. I do enjoy this though, but it's hard because you want to be able to understand where other people are coming from. You want to be able to create that dialogue with them. And so as you're looking at being that innovator in the room, being that innovator in your community, in your space, wherever you may be and wherever you're thinking about innovation, be open to not only listening, but then also be open to changing your own perception and your own understanding of what a solution needs to look like, or how you go about solving a problem. Because if you can sort of come out of your head, come out of that box within which, or the rigidness that you may have, you quickly understand. One, you're quickly humbled in thinking that the more you know, the less you know. But also because once you start truly listening to, again, whoever your users, your customers, your stakeholders are, you quickly start understanding that, hey, I can connect the dots in this way. No one else is seeing it, but now I have a unique insight. I have a unique vision that is fueled by exactly what people are telling me about the solution that they want, right? And as a founder, you're in a very unique way, or so as an entrepreneur, you're in a very unique position to help connect those dots. And the way you do that, and you mentioned something that I did not have a health background, and again, I walked into talk to these clinics and these nurses and these providers, these doctors, with that in hand, to say, like, I don't understand health. What I do understand, though, is technology. What I do understand is business. But I want to be able to bridge that to a solution within health, because I've had a pain point here that I want to solve for. That's the place they came for. And you'd be surprised when you walk into a room being vulnerable, you walk into a conversation, a meeting, being vulnerable and really saying, I don't have all the answers, but I'm turning to your guidance. I would love your feedback. You'd be surprised how many people want to share their knowledge and their expertise.
You mentioned your understanding of technology as being one of your unique attributes and what has allowed you to participate meaningfully in this space. I want to key on that for a second. What role do emerging technologies and culturally sensitive innovations play in addressing SDOH, and how can they be leveraged to drive measurable outcomes?
I'll say this. I think when we think about solutions, the role that technology can play within healthcare, we've barely scratched the surface. There's just so much opportunity to innovate. Now, I know that healthcare space is notoriously known for slow adoption. So don't think if I innovate a solution tomorrow, it'll be out there and about there. It's not quite that. I don't want to talk about rainbows and sunshine, because it's not always that. But realistically, as we're thinking about technologies, like, healthcare has been really hard to adopt. And part of that is regulation. Part of that is just in the way some of the systems, archaic systems, are set up. It's a number of different things. But what I can say is that when you look at the role that technology can play, there's a lot of room for innovation, which means for all the founders in the room and online here today, there's a lot of room for innovation still, right? Which means that if you are able to look in other sectors and other industries where innovation is done well and how it's done well, there are certain things that you can almost replicate within healthcare to solve similar problems, and not replicate to the T, of course, with some caveats there. But the point being is that there's a lot of work to be done there. For instance, we talk about generative AI capabilities, right? That's all the buzz. And when we talk about generative AI capabilities, well, what does that mean? What application can it be used? There's so many examples today within healthcare where this can be brought in. It's not being brought in, or it's being brought in, but to a limited extent, or it's being brought in and to a limited extent, and or to a vast extent, but not being adopted in quite that way. So there are lots of opportunities along this workflow, along this cycle, where you can bring your own unique value proposition and bring your own innovation to be able to accelerate or bridge into a solution that you think will have a long-term impact. But with that, I feel like, one, there's a lot of opportunity on the table, and two, where founders in the room and here again online can really be able to explore lots of opportunities that otherwise, 5-6 years ago just did not exist for us.
Gotcha. And there's a concept called proximity blindness, where if you work in an environment for any period of time, you tend to lose kind of your ability to see the playing field because you're focused on what you're doing versus coming into an environment and simply asking, why is it being done this way? And that being very important by way of what it is that we're looking to do by way of engaging folks such as yourself, whether you have healthcare backgrounds or not, is not a qualifier or disqualifier. It's really, what is it that you bring to a particular problem and or solution, and how you can plug into these environments. In previous sessions in year one, that was kind of a theme over and over again, is what is it that this program can do to help educate and empower and resource folks who are not in these environments? Because yes, it is healthcare and it's complicated, and there's a cycle to this, and that implies time. But there's also a statement that says just because you're doing good work doesn't mean that you can't be rewarded handsomely. And I think that is true as well. And we're starting to prove that out through creating these platforms of sustainable enterprises versus us committing to something and not necessarily seeing the long-term impact and outcomes. And that really does imply a fresh perspective of people coming in and asking, why are we doing it this way? There are ways to do this different, better, faster, cheaper, etc. But really, as part of this programming, continuing to focus centrally on the social determinants of health. Because as Linda mentioned earlier, there's so much that happens outside of a hospital environment that informs a person's total journey with health and quality of life. The questions that we were asking are really just kind of intended to start to spark a conversation with folks who are both in the room and online. So I wanted to open that up. Do we have any questions in the room first?
Hi, thank you for the talk. And the question I have is, do you feel that for the health issues, you need to work also with the mindset of the person? So we often want to change our habits or to create new habits, but something stops us. After a week, we're done, then we try again, and then again we stop. So is there something that you do from the mindset side, something like that?
Yeah, absolutely. Thank you for that question, by the way. And you're absolutely right. Anything around our health, or anything around, even non-health, if we want to make a change on it, it is all a mindset, right? At the end of the day. And what we do, so as a company that provides lifestyle change, we certainly try to hone in on that with the education we provide. We're looking at some generative capabilities within which we'll really be able to scale that as well. But at the heart of it, I think the crux of it is that unless a person is ready to make that change, it's really hard to adopt anything, right? There's only so many times you can be told to do a certain thing and then you'll follow through and you'll do it. But ultimately, it has to be your will. So we try to address some of that, but some of that is so innate that it's hard to be able to sort of account for all instances within which a person may not be able to change those habits.
I'm going to add to that. In a previous session, Matt Duke from Duke Capital, who's intimately involved in these programs, kind of touched on root cause. your question being, we put these things in motion and folks commit to them for a period of time, but inevitably they decommit from these things for whatever the reasons may be. And the answer to that on our side is being more curious about the whys of that and what are the root causes. So again, does that connect to some type of socioeconomic reason? Does it relate to some kind of food insecurity reason, social support reason, and really understanding the social determinants of health and how to connect those to the root cause of the behaviors that you've mentioned. So certainly I think we've all kind of been in those kinds of cycles. It's the new year, we're going to the gym, and then by mid-January, February, nobody's going to the gym. But there are causes for those things that we can get curious about. And once we've gotten curious about them and really dug into the root cause issues, is trying to then attach those to the innovative works that through this program we're trying to resource into sustainable enterprise. It's a great question. We have a question online that is about sustainability and revenue. It's how do you foresee sustaining, growing your business, and how do you generate revenues to do so?
Yep. So what we do today is we're able to bill health insurance for the work that we do. And within health insurance, we work with Medicaid, also Medicare. And so we're able to bill them for the work that we provide. So all of our tech-enabled services have codes associated with it, and then we're able to build those codes. This also goes back to something I had mentioned earlier, which is sometimes your customer and your end user are not the same people. And that applies in our case as well, where our customer is a health plan, but our user is a beneficiary of that health plan.
So I'll ask a follow-up to that, and it's really specific to the accelerator itself, because as I've had a chance to take a look at the programming, certainly the theming in that programming is how do we get enterprise to be sustainable and to have revenue? Now, that being said, the cohort was a mix of companies of any different stage. So based upon your stage, was there something in the accelerator that helped to either enhance sustainability and or help to connect the dots on revenue?
Yeah. So in Texas, for us, a lot of that is going to come through some of the like MHM type dollars, right? That help us prove certain things out that we can take to employers then. And that's something that came through the accelerator where we started looking at, well, in the way we understand health plans as a customer, there's perhaps a second customer type that we've not even explored that would be worthwhile exploring. We're still on our pathway to do that. I can't say that we've nailed it quite yet, but the accelerator definitely planted the seed for us to be able to explore some of those opportunities outside of government healthcare spending and those dollars.
Thank you for sharing.
Okay, so I'll go ahead and start off by first saying I am a nurse, and a couple of different projects we're working on, and then I'll circle back around to my question. One of the projects we're working on is developing curriculum in entry-level healthcare occupations that utilizes bilingual sentencing, which means one sentence is in English repeated in Spanish. So immediately there's an ESL, SSL component as they learn the topics. The other project we're working on is the utilization of virtual reality, where we're building simulations for special education kids to teach them how to go to work while we're monitoring biofeedback and brainwaves. Now, the whole compass of that is a lot of work in animation and video. And so when I think of cultural change in regards to different dynamics throughout the history, entertainment has really driven a lot of cultural change. Music, movies, stage performances, things that incorporate issues of diabetes within the play, not preaching, but incorporate it so that it goes from the back of the mind to the forefront of the mind culturally for those people that do have diabetes, and how that person on stage as their character is taking care of that. What do you think about that kind of concept? And am I just kind of barking up the wrong tree, or what do you think about that?
I think exploring different, from what I understand and what you mentioned, is like different modalities of interaction through which you can create something to the earlier question around behavior change. That's what you're trying to do at the end of the day, right? Make behavior change happen. And exploring those different modalities that can lead to that behavior change, I feel, is another untapped opportunity. I feel There's a lot of work to be done. Now, the only thing I would caution you is like, what are the long-term sustainability around it, be willing to pay for it and all that. And if you have that figured out, great. But that's the only thing I would say. But when it comes to, for instance, looking at virtual reality or looking at some of these things that may exist and looking at video, for instance, or audio as a different modality to be able to provide information, it's always great to explore. And what I would also recommend is as you're looking at that and looking at evidence-based ways in which this can happen, look within models that have already been researched, but that have already been experimented with, and see what you can even learn on it. So you're iterating rather than building from scratch. And so that will give you hopefully a jump start into how you're sort of approaching this. So that would be my only 2 cents to add.
So my 2 cents on this is, earlier I mentioned Shireen walking out to the Beyonce song. It got people's attention. It was something that folks could immediately identify with, which then allowed her to progress into her pitch. In addition to that is, I think, what you've mentioned is very important in the respect that new ways to deliver information, new ways to engage. Right. So folks who would be interested in healthcare or not interested in healthcare, if they had the opportunity to gamify the space or create entertainment packages around subject matter that would get them into industry, is very similar to why we have engaged with Velocity, is that as we've looked at all of the things that they're trying to do in the community, and the community being defined not just as San Antonio, but South Texas, is really trying to amplify their message through things that are going to capture people's attention, whether that's social media strategies, whether that's opportunities for folks to come together and connect in person through purposeful happy hours, if you will, but also demonstrating technology and innovation. And a lot of the theming of what I've seen is exactly what you've touched on, AR, VR, mixed use, and a lot of technology that may not have otherwise made its way into this space. It goes back to kind of what we've been talking about is you don't have to have a health background. Certainly if you do, it's very informative to the experience. But if you're working in that environment on a day in, day out basis, there may be some things that you miss that a person who, again, is looking on say, hey, look, do this. If you did this thing, you would get this much more attention or traction. So I think that's a suggestion is spot on. It's certainly kind of aligned to the environment that we're in. Folks need to be messaged quickly. They need to understand why this is aligned to them, why it should capture their attention. People's attention nowadays, it comes at a premium. And certainly I don't think that anybody can argue that what it is that we're talking about, health outcomes, is one of the most critical conversations that we could be having and really is worthy of folks' attention. Great question.
Hi, Shireen. My name is Armando Hernandez. I'm actually in the benefits industry. I have been doing this for 12 years. And one of the challenges it's for small and mid-sized businesses, healthcare. The cost of healthcare. When we're thinking about health, most of the people living in the U.S. they work on small and mid-sized businesses, and sometimes they don't have resources, and those are sometimes the struggles that we have, because that's the market that we focus in, to even afford health insurance to offer to their employees. What kind of ideas you will bring, because I think that the diet on each one of the citizens here in the United States is very important, and I think that's a good way of getting to them, because that's where most people spend, unfortunately, their time with in their work site or with their employers.
So if I understand your question correctly, what you're asking is like how to get in front of like uninsured populations or employer populations that provide insurance.
It's more in how to get the employers involved in the diet, in the health of their employees, because sometimes they are limiting resources to allocate a budget on that aspect.
The biggest thing I would say to that is it's the ROI. right, for any business. As you may know, as you know, being a benefits manager, at the end of the day, it is, you know, you have to make a case for why it is important for their population to have the suite of services that, you know, that you may, for instance, recommend. At the end of the day, if we can show that, so for instance, we do work in prevention. What we're able to show in the work that we do, and it's on the prevention side, which is of course harder than when you're managing a disease, right? So there's a difference there, but we'll go with the prevention example. For us, essentially, it is a 10x return for the employer at the end of the day to go with us. Proven out. And by the way, CDC has information. This is not like, oh, a company is putting a number out there, so how much, you know, bias they may be in there. But CDC has put this information out to say, like, prevention dollars for this work that we do turns into a 10x return for an employer down the road. And so a lot of it is understanding the customer, you know, and what fuels them to make that decision. And it is largely, when we're talking in this employer market specifically, it is the ROI. So if we can drive that very consistently for an employer, these types of solutions can be adopted. I have no doubt in my mind that ROI carries that conversation forward. There's of course the feel good factor, like, you know, like you were alluding to. There's some of that, but what really drives those decisions forward is the ROI that you can show an employer. And especially when it's a self-insured employer, right? When the employer is large enough to where they're taking on that risk, then it just becomes a cost reduction conversation for them.
Yeah, you mentioned something, you know, prevention versus intervention, and really just the alignment of language to the audience, right? So when we talk about a happier, healthier employee, that may create a happy workforce and morale. But if we should really start to talk about efficiency and less days missed from work and how that then translates to functional ROI and results, again, depending upon who you're trying to sell this through to, is sometime alignment of language, because there's enough data points at this point that exist that shows if the employer has a commitment to the employee, and not just by way of offering medical benefits, which is access to care, but really kind of the theming of this programming is going further back and figuring out root causes and prevention. Certainly there's a lot of data points around that. Great question.
Hi, Shireen. Nice to meet you. My question is most towards the program, the acceleration program that you went through. So we're here at eBridge are trying, and at the university are trying to ignite our community to be part of this series, not only for them to learn and experience and get more information, but also to be candidates to possibly participate in the accelerator program. Take us through that journey in terms of commitment percentages. You know, how much are the participants committed to this program, the hours that need to be spent to be able to have a successful pitch and then maybe be one of the winners. I think a lot of our entrepreneurs tend to say, okay, well, I'll dedicate most of my time, but then they have other jobs, they have family, they have, you know, commitments that they need to address. So if you would mind taking us through your accelerator journey so we can understand a little bit about the commitment level and the amount of work that requires for them to spend to be able to have a successful pitch.
Absolutely. Happy to share that. I can't pinpoint the number of hours I have spent, but I'll tell you that on a weekly basis. But I can tell you in the time that essentially going through the accelerator program, I want to say that maybe they maybe asked for a commitment of 10 to 15 hours per week, and I'm ballparking here, so please don't hold me to that. But I know I spend a lot more time. And largely because, I'll break up my response, because one is, you know, what you mentioned around like just having other responsibilities and other job. You're trying to do something new. You're not sure if it's going to catch wings just yet, but at the same time, there are bills to be paid, right? At some point, by the way, I was in much the same position myself. And at some point, I just had to make the transition out from my full-time role into this. And of course, this doesn't pay right out the gate. So you also have to understand what your saving situation or whatever your financial situation would look like. So I would say, of course, be pragmatic, right, and understanding. And if this is not the right time, then maybe it is the future. You have to be pragmatic in your financial decisions and try to understand what are those opportunities that may be available to you. And if you can leverage some of that, there is, like I was, we were joking about this earlier, but I truly mean it. A founder's hustle is a founder's hustle. It is nights, it is weekends, it is giving up time with family. It is, unfortunately, it is all those things that are not shiny and they're not pretty at all. And so at the end of the day, you have to understand, where am I willing to give up time with family? Where am I willing to give up time with friends, or, certain things that may be important to you today. And if you are able to find that time, I would say explore it. At least you said, I explored something that I was tinkering with at the back of my mind. I thought there was a solution here. I think there's something here. At least live it to the fullest to say, okay, you know what? I tried this out and it didn't work. And that is okay too. It is completely, completely okay to fail and say, I gave it my best, I gave it my all, and it didn't work out. That's okay. At least now you can move past that idea and move on to the next thing in your life. But give it the fair time it needs to be able to nurture it, to see if it's something that can catch with.
Appreciate you sharing that. The comprehensive statement is, as with anything, you get out of it what you put into it. And what our responsibility is to the cohort is to continue to listen to the feedback of folks like Shireen, to make sure that the programming is less impacting on time, more impactful on its intended outcome. But no matter how you slice it, whether it's this program or the variety of others that may exist out of there, is if you're going to own a business, if you're going to start an entrepreneurial journey, it is tough work and it requires a lot. And this program is not intended to make that part of it easy, because there's nothing that we or anybody else could offer that would make that easy. It is a commitment of time. It is a sacrifice. It's an awareness of a lot of things that are well outside of our control, more than us being able to try to meet you at a place. And whether that's halfway or more than halfway, but trying to resource a journey. Now, I'll go back to the point of, if you're not the innovator, that doesn't mean that you don't have a place. That doesn't mean that you can't participate. Doesn't mean that we don't want you to participate. Awareness of what SDOH is critically important. Knowing that this opportunity and program exists, also very important. So again, like I said at the beginning, is whether you are the person who is going to start this journey or apply for this accelerator, or whether you're somebody who is just amplifying a message because you have somebody in your network that hey, look, this is something for you, is really what we're trying to do to program, is take the feedback out of year one, try to make sure that we're continuing to tailor the programming to folks like Shireen and the folks who are both in this room and online, but also kind of stated over and over again, is that there's a place for everybody in the community, not just to be aware of what this is, but to participate. Really appreciate you sharing your journey, Shireen. All right, we have time for one more question if we have it. Is there anything either online or in the room? Sean, is a small LLC trying to establish in San Antonio, where we look to work with government and the medical industry. Can you share insights on working with city, community, governments in your efforts, i.e. collaboration on focus areas, pharmaceuticals, or clinical deserts in specific communities?
All right, very light question at the end there. All right, I'll take a stab at it. What we've done in the past is we have, actually, you mentioned, I believe I saw the mention for government and medical industry. So I'm going to try to answer it in this way, that in the early days, we actually did some R&D work working with the military. Some of the government work we're doing today is what I've previously mentioned, but I won't harp on that anymore. But we did do some work in the military, and where essentially, long story short, we've created programs for recruits to be able to meet weight standards needed for recruitment. But we did do some of that work, and through in sort of the collaboration that we had along the way, a lot of it was network driven. So going out there, going to events like this, being present there, networking with people, looking to understand what are some of those customers that exist out there. Ultimately, our customer was like 3 handshakes away from a mentor that I had at the time, and she helped me connect the dots to say, hey, you want to do this in the military. I know this person, and she connected me to someone who connected me to someone else, who then connected me to someone else. But that's how we got to really get in front of the right person to help us do some of these programs. So all that I would share in trying to, to the question, to try to establish some of these partnerships and even these mutually benefiting pilots, if you will, is just work that network. Go out to events, go out to apply to accelerator programs like this one, because you will meet people, you will network with people outside of your immediate circle, outside of your immediate LinkedIn connection. Get in front of them, tell them what you are doing, what you are planning to do, why it's important, why it matters, who your ideal customer is. Be absolutely shameless in sharing what you're doing, and share it with them with a very strong intent to get connections. People, you'll be surprised how wide your immediate network can be. And if you leverage it in the right way, you can be in front of the right people pretty soon. I'll also mention one more quick thing, depending on the business type, but sometimes there are opportunities for women-owned businesses, for instance, or small businesses. And that also opens up additional pathways for mentors, for networks that you can tap into. So I would say look into that as well, because you never know where you can find that network of someone who can unlock a potential customer or partner for you.
So I'm going to give you a cheat code. People who are in the room and online, it starts with the folks who are presenting you the information today. So if you are in the Valley, I would encourage you to engage deeper with eBridge, but also get curious about Velocity Texas and its mission, its alignment to the Department of Defense and its military customers that it's welcomed into its environment. The 59th Medical Wing, USA, ISR, and NAMRU are, I don't want to say easy connections, but established connections through these ecosystems and these accelerators that are meant to connect folks like Sean to that opportunity. There's also a conference that happens on an annual basis, that being the AIM Health Research and Development Summit, that will be in San Antonio, June 23rd and 24th. And it's expressed intent is to connect enterprise to military opportunity. So if that's something that you're interested in, sometimes the most obvious answer is if you're in San Antonio or in the Valley, please connect with eBridge, get curious about Velocity's mission and the opportunities that they have in addition to the accelerator program that we're talking about today. I really want to thank everybody for being here, both in the room and online, for your interactivity, your thoughtful questions. Shireen, one more time, thank you so much for being generous with your time and your experience. We wish you the best of luck. Congratulations again on your win last year. I'm sure that we'll see you again in the near future. Now, what's next? Our next session is February 27th. I would encourage you to register. I would encourage you to, again, amplify this message. You have been here. You have heard from us. This is not going to be the same information over and over again. This is a series of information that is intended to get us closer to the type of healthcare outcomes that Velocity, MHM, and UTRGV have imagined for this program. It is a multi-year program. We are in year 2. We're at the kind of very beginning of year 2. The applications for the accelerator program are still open. They close, I believe, June 1st. They start next month and will close June 1st. Again, we are looking at the dynamic of that program to make sure that it is less impacting on time, more impactful on outcome. But again, these seminar series are very helpful in setting expectation and calling awareness to the program, the partners, and what it is that we're trying to accomplish through these multi-year investments. So again, our next opportunity is February 27th. We will welcome in our guest speaker, Jose Padilla. In addition to being a lawyer by trade, he is also very, very active in new technology. He has a platform by the name of Legalmente AI, which is what he calls basically kind of the AI LegalZoom, if you will. So very engaging individual, dynamic speaker. I welcome for you to attend. Again, thank you very much for being here today. This concludes our